One of the most vigorously debated issues, particularly over the past 4 years, has been health care. The Affordable Care Act, commonly referred to as Obamacare, is praised by supporters as morally imperative and long overdue, but denounced by opponents as destructive to both our economy and our freedom. Do you have a better solution than Obamacare? And if so, what is it? Mr. Cross.
I do have a better solution than Obamacare. I will comment on Obamacare. The Supreme Court agreed to support him as a dedicated person to the Constitution. I find no basis, as reading it, that the federal government would get to the point that they're fining individual citizens $500. That's way beyond the reach of limited government as intended. But we do have a reality that we have to improve the medical system in our country. We have serious problems. Right now we have about 60,000 fewer doctors than we need, and by 2025 there will be about 120,000 fewer doctors than we need, which will tend to drive up price no matter how people are striving to find ways to cut costs merely by supply and demand. So to get more doctors into business, to provide more healthcare professionals, we need to get into the process of supporting the education of doctors as well as other people, which ties into my education program. You heard our priorities from the Afghan war and set our priorities on the cornerstone of America's strength in the future, which is our young people and our education program.
Mr. Chlapowski.
I think with Obamacare you have a burden, again, that's placed on businesses who employ more than 50 people. There may be a borderline business as far as financial viability, and when you dump this burden over on these businesses, you're going to be killing jobs again. And I feel the Obama administration is a job killer in many respects because of their lack of understanding of business. I take this cost, if we want to take care of all of our people with their health problems, has to be an internalized cost if we have this huge balance of trade. And again, if you look at the cash flow picture, all of these monies that we put out there are flowing eventually over into the foreign economies that are manufacturing, which is no longer the U.S. economy. So we have to internalize the cost initially, and if we make certain that we don't have abuse of the system by illegal aliens who are in the system and running up our costs, then we can achieve that we take care of our people, and at some point those in the healthcare world will not have a constrained currency that they get paid with this internalized cost, and we again have enough manufacturing jobs to pay for what we have. This area has to be cut in regards to external cash flow generating imbalance of trade.
Mr. Barnett.
Well, I have a much better plan than Obamacare or the Health Care Act that Obama's put forward. Number one, as you heard me state before, I believe that we can place a bit of that burden on corporations. If they're going to get a 9.5% corporate tax rate, they can definitely afford to pay those premiums. And that's giving back. Now, at the same time, what I've offered up is to let them negotiate those rates that they're going to pay for those premiums. If they're negotiating those rates, we can actually put the healthcare requirement into the GSA. The GSA is a well-known vehicle that the government utilizes for acquisition right now. And that GSA makes it so you have got every business that is providing services or product has to provide them with the lowest cost that they have offered to any other business or any other person at any time. That low cost is what the government can then use to provide their health care in the programs that we're providing. Now, that also stipulates that we are going to have an influx of people that are covered, and we're going to need more doctors, we're going to need more nurses, we're going to need more healthcare staff. And that ties in with my education program as well, because I believe that what we can do is create a system, or actually implement the system, because there's a couple places that already do it, but where we're saying, if you go into this field, just like in the military, if you give us some of that time afterwards, give us 4 years of work afterwards, we'll pay for your schooling as well. I think that is going to encourage people to get into those fields. I think it's going to encourage people to give back to this government, to this country. And that's that patriotic spirit that we need to nurture here. Getting people to want to give back to this country. Getting people to want to do more for the community and for other people. That's the only way that we can make this work.
1 minute follow-up, Mr. Cross.
First, I want to say that I agree with many aspects of Mr. Barnett's, especially the aspect of you pay for their college, they return in service. Some might say, well, that doesn't help me because if they go to the desolate areas and so forth, I'm not in a desolate area, but the teachers that go there and spend a few years getting knowledge will end up moving into other areas anyway. So certainly the concept of paying for their college to get more doctors and then having them serve is a good idea. What I do is beyond that, let me cut a different direction. In Medicare, we have to recognize that we're getting in $200 billion a year in revenue from payroll taxes and spending $500 billion. So we got a problem there, and we've got to cut those two closer together to save Medicare. My plan does save it. I'm afraid the Republicans are planning to try to eliminate it.
Mr. Chlapowski.
I think that you have to, again, live within your means, and you will have to reduce the services if you do not internalize the cost. Otherwise, we go bankrupt, because one of the big contributors to our huge debt will be Obamacare or any health program of this nature. I agree with the aspect of providing trained nurses and doctors into the system through time and service.
Mr. Barnett.
One of the things I did want to clarify, though, when we're talking about people being covered under health care, in my plan, it actually allows for the diminishment or the drawdown in size of government as well. Because I believe that the same entity that documents your employees or provides for documented employee, they can be the ones that document whether or not you're providing that health care is required as a company. That means we don't need all of the legislation out there. We don't need the government out there negotiating prices. We don't need them at the table with them. We can make sure that people are covered, that they have adequate coverage, and that the corporations are actually providing that coverage to them without the benefit or the enlarged, bloated government aspect in the mix. That cuts down on taxpayer dollars, and I think that's another thing that we have to do. If we want to get out of the debt crisis that we're in, or the debt that we have to China, the debt that we have to our American citizens, we're going to have to draw back the size of government.